This evening we're talking to Abbie Pinter. Abbie is our afternoon co-op here at the office, and we're exceptionally proud to have her on staff. She's going to be talking today about a condition called achromatopsia. Abbie, take us away.
Alright, so achromatopsia. So this is a condition that is characterized by either partial absence of color vision or total absence of color vision. So an individual with this disorder will only be able to see black, white, and gray, so they won't have any color that they're seeing. Now, this is a hereditary visual disorder, meaning that it is based on the genetics in your family, and it is non-progressive, meaning that it will not get worse. Some of the symptoms of this are light sensitivity, absence of color vision, nystagmus, which is the shaking of the eyes, and then decreased vision. So there are two types of achromatopsia. There are complete achromatopsia, which means that there is none of your cones are functioning. And I'm going to talk about the cones in your eye in just a minute. And then we have incomplete achromatopsia, which means that some of your cones are functioning. So with complete, we have reduced vision. That's going to be, the normal is kind of around 2200, so it's not great. Usually the perfect vision is 20/20. Again, nystagmus is common, and then light sensitivity is pretty bad with them. They'll often have to squint to make their eyes feel a little bit more relaxed, and then you are going to have no color vision at all. And then with incomplete, we have decreased vision. That's usually around 20/80 to 21/20, so it's a little bit better, still not great though. You could have some of the symptoms of like the light sensitivity, but they could be a little bit reduced. And then you are going to be able to partially see colors because some of your cones are working. So before I go on, I'm just going to clarify that it is different from being colorblind. So an individual that is colorblind has trouble distinguishing between two colors. So here's like a common color test. They might have trouble distinguishing between like green and reds. They might just see it all as green. But with achromatopsia, you don't see any of these colors. So if you're colorblind, your cones are still functioning. They just perceive light differently.
So it's a complete lack of color.
Yes.
Wow.
So these cones that I have been mentioning, so in the eye, in the back of your eye, the retina, you have cones and rods. So rods, there's only one type of rod, and the rods function in like low light levels, so kind of at night, but they can't perceive any color because they can only send one signal to the brain. But we also have cones, and these function in brighter light levels, and also they are what perceive color vision. So how this works is we have three cones. We have red, green, and blue. So say you see something that is yellow. So your eye is going to perceive this because the green cone and the red cone are going to be stimulated, and then they send this signal to the brain that you see yellow. So a person with achromatopsia is not going to have any of these cones working, or if you have the incomplete, they might be working, so you might see a couple colors. So genetics is what causes this. It is an estimated that there are 1 in 30,000 individuals that this is affecting, and it is an inherited autosomal recessive pattern, meaning that since every individual has 46 chromosomes, like the pairs, the one from your mother and the one from your father, if any of these genes down here are mutated, because these genes prevent cones from reacting to light properly, it has to be, to have this disorder, you have to have the mutated gene from both your mother and your father. If you have it from just your father or just from your mother, you're just a carrier for it. You don't actually have the condition. And then this is more common in regions where there's a high rate of marriages between relatives, and this is most likely because they have that carrier mutated gene, so it's more common that you could have it. And then treatment and diagnosis. So for the diagnosis, it's always helpful to do these color tests at the eye doctor. They give kind of like a baseline to see if there's anything going on with your vision in reference to color. But there's also an ERG, and this is a more definitive test, and this is because it shows the specific waveform shapes. So for this particular disorder, it is much more definitive and saying if you have it or not. Currently there is no treatment for it, however they are doing clinical trials with a lot of mice and young dogs, and they have had some success with gene therapy, but there are some options for people with this if they want to decrease their symptoms. For example, we have these deep red tinted sunglasses, and these help with the light sensitivity. So as I mentioned earlier, the light sensitivity is just so bright that they often have to squint, and with these it will reduce those symptoms and you won't have to squint as much. So there is that, and they also have contacts now where you can put those in, so if you don't want to wear the glasses. And then these are my sources.
Very nice job. All right, ladies and gentlemen, this is Abbie Pinter. She is our amazing afternoon co-op. We're so happy to have her on staff here. So please look out for next month's presentation, which will be on?
I'm not sure yet.
Excellent. I bet it's going to be amazing. Thank you so much, Abbie.